Well, good morning, everybody. My name is Hendricks, and I have the pleasure of co-chairing this third workshop as part of the Children's Cognitive, Affective, and Behavioral Health Forum at IOM with my colleague Bill Beardslee, who will be giving an introduction as well. So I'm very pleased to have people here for this presentation on the workshop on innovations in design and utilization of measurement systems to promote children's cognitive, affective, and behavioral health. I did want to give a brief introduction of what the content is and what we're aiming to do at this workshop. Obviously, a workshop of 1.5 days goes rapidly, and we have packed in many, many exciting and innovative researchers, practitioners, policymakers to make changes and move the field. So our job in here today is to look at new approaches to build on existing data systems, to design new ones and build them into integrated measurement systems. These systems can monitor and provide actionable feedback to improve local, regional, and national health systems quality, and practice and program delivery. Ultimately, they are decision support tools that we would use to monitor and guide the following things: the selection of target communities, the targeting of risk and protective factors, strategies to change health systems, policies and their practices, as well as strategies to improve overall delivery of care. We're looking at ways of being innovative and provide efficient means to assess, assemble, and integrate data into action. And we're going to be using illustrations that are all the way from local communities to the national level. We focus on the future in this one, so we're talking about ways that are not yet completely available for everybody, but we're looking at ways to export them and to move them into dissemination and implementation. So welcome everybody, and I think this will be a great session. Bill?
Well, I add my welcome, and in particular my thanks to the Planning Committee and to the IOM staff for putting this together. It promises to be a great set of presentations. We had a meeting in April last year, mostly focused on interventions, one in June focused more on systems, and this one now comes to data. One of the early questions we had, or one of the early observations about data, was that data in one system rarely crosses over into another. So data in the healthcare system rarely is used in schools, or data in the either juvenile justice or social welfare systems are rarely used in health. And so as we think about systems and how to improve them, I think we also need to keep very much in mind that it's the same families that show up in the different systems, and how can we make data most efficient for the families across systems as well as within systems. That said, I think ultimately our capacity to implement widely and to improve the health of the children through effective treatments and interventions disseminated widely really depends on the collection of data and the use of data for continuous quality improvement. So this is a crucially important forum. Thank you.